بسم الله الرحمن الرحيم. الأستاذ المساعد دكتور أحمد صلاح حميد من كلية طب الاسنان قسم جراحة الفم. محاضرة اليوم سوف تكون Dental Management of Patient with Congenital Heart Disease. So here the neonates born with certain congenital heart disease, and actually this heart defect or this heart disease, this actually might be manifested clinically or sometimes might not be manifested clinically, and this gives certain side effect during dental management. So first of all, let us classify the congenital heart disease. There are many classifications of the congenital heart disease, could be classified according to shunting of blood. So in case, first of all, we can classify the congenital heart disease into shunting of blood from left to right, and this includes ventricular septal defect, arterial septal defect, and patent ductus arteriosus. Or shunting of blood from right to left, such as transposition of great vessels such as aorta or pulmonary artery, Tremcas Artriosos, and tetralogy of Fowler's. Sometimes can be classified according to obstruction of blood flow, as in case of pulmonary stenosis, or could be classified according to cyanotic or acyanotic. Sometimes according to, or these conditions may occur due to genetic or environmental factor. Genetic, that means in case of certain genetic disorders, such as in case of trisomy, or in case of Down syndrome, or in certain situation, the patient or the pregnant woman might be subjected to chemicals, radiation, or taking certain drugs, thalidomide or lithium, and this will lead to the neonates will born with certain congenital heart disease. Here we can see this is the examples of shunting of blood from left to right, as in case of arterial septal defect, or in case of ventricular septal defect, or in case of patent ductus arteriosus. So here, shunting of blood from left to right due to forceful contraction of the left side of the heart. Here, patent ductus arteriosus, actually this duct could be seen during embryonic development, but it should be disappeared after 2 to 3 weeks after delivery. But in certain people, the duct is still present. And this connects between the arch of aorta or aorta and the pulmonary artery, and this actually will lead to shunting of blood from left to right. An example of shunting of blood from right to left including transposition of the great vessel. As we can see here, the aorta, it should be arise from the left ventricle. It should be arise from the left ventricle, but as we can see here, it arises from the right ventricle. Or even the pulmonary artery, it should be arising from the right ventricle, but here we can see it arises from the left ventricle. So this is transposition of the great vessel, which lead to shunting of blood from the right to left. Here we have Tremcas Artriosos, which is the structure across the trunk or main trunk, and then after it will be separated into aorta and pulmonary artery. But this might be lead to still, and this is also causing shunting of blood from the right to left. Usually, actually, cyanosis, or when we call that the patient cyanotic during physical exercise or during crying, this usually is associated with shunting of blood from right to left because there is more deoxygenated blood, and this will lead to cyanosis. Another example of shunting of blood from right to left is tetralogy of Fowler, which includes 4 components from its name, tetralogy. It includes ventricular septal defect, pulmonary stenosis, and also there is ventricular hypertrophy or thickened muscle of the heart, which is also ventricular hypertrophy, and also correctation of the aorta. So correctation of the aorta, ventricular septal defect, pulmonary stenosis, ventricular hypertrophy, these components of tetralogy of Fowler, which also causes shrinking of blood from right to left and causes cyanosis. Why dentists should be aware of this condition? Due to development of bacterial endocarditis or bacterial endarteritis. Sometimes the patient might develop bleeding problems because usually patients with congenital heart disease, particularly those with cyanosis, shunting of blood from right to left, there is compensation, increase in the production of the RBC in order to compensate for the decrease in the oxygenated blood. So this will lead to polycythemia, and this polycythemia will occur at the expense of the platelet number. That means there is decrease in the platelet count, thrombocytopenia, and also there is deficiency in certain factors, coagulation factors. So there is bleeding problem. Sometimes the patient might be taking anticoagulants, and also this will lead to bleeding problem. For this reason, there should be aware of this condition. Sometimes the patient might develop cardiac failure or even pulmonary edema. Clinical manifestation, usually the patient complains of dyspnea, shortness of breathing, cyanosis due to increase in the deoxygenated blood, polycythemia, as we can see here. This is the ruddy complexion of the patient due to polycythemia, increase in the production of the RBC, fainting or dizziness, finger clumping, we can see here. This is the finger clumping, and also cyanosis, shunting of blood from right to left. Weakness, congestive heart failure, and distension of the neck vein. Actually, distension of the neck vein associated with congestive heart failure. How we can diagnose those patients with congenital heart disease? Through bleeding and prothrombin time. Actually, prothrombin time measuring the extrinsic pathway, and the bleeding also measuring the function of the platelets, because usually the patient complains of polycythemia, and there is also thrombocytopenia. Chest radiograph also, echocardiography, here we can see this is the echocardiography. Angiocardiography, this is also can be used to diagnose those patients. Computed tomography and magnetic resonance imagination, and also electrocardiography can be used to diagnose such a patient. How we can give medical treatment? Actually, this is the responsibility of the pediatrician. There is also what we call there is surgical or surgery, and this includes corrective surgery unless there is sign symptom. That means corrective surgery for congenital heart defect cannot be done unless there is sign symptom. So if there is cyanosis, if there is dyspnea, if there is any complication, in this case we can do corrective surgery, and usually it should be operated after 4 to 6 years after delivery. 4 to 6 years after of life, we can do corrective surgery for the congenital heart defect. Sometimes the patient might be given digitalis antiarrhythmia for ventricular fibrillation, which is type of arrhythmia. Anticoagulants, this is warfarin or coumarin, to smoothen the blood and increase the blood flow to prevent the thrombus formation. Pregnant with congenital heart disease may die during delivery because of the complication might occur because of the congenital heart disease. How we can give dental management of those patients? Any elective or optional dental procedure should be postponed for symptomatic patient. Patient with cyanosis, dyspnea, clumping fingers, ruddy complexion, all of these symptomatic, that means there is any symptom should be postponed. A symptomatic patient without clinical manifestation can be treated under antibiotic cover, prophylaxis antibiotics. Patient who has corrective surgery for more than 6 months are those who treated without synthetic material or artificial material, and there is no other defects, does not need prophylactic antibiotics. So if there is corrective surgery more than 6 months or without any artificial material, so in this case there is no need for prophylactic antibiotic. Laboratory tests such as bleeding time and prothrombin time should be screened to check hemostatic mechanism. As I mentioned before, patient with congenital heart disease, because of polycythemia, the patient may develop deficiency in the coagulation factors or even thrombocytopenia. For this reason, we have to check platelet function and even the prothrombin time. Patient on anticoagulants, those to prevent thrombosis, we give the patient anticoagulants, should be referred to their physician for medical evaluation before giving dental procedure, because we need to decrease or diminish the amount of anticoagulants, because so this is the responsibility of the physician. Lastly, patient with congenital heart disease and has other complications such as congestive heart failure should be managed according to the condition. That means any patient with congestive heart failure, that means we have to deal with those patients as we manage patients with congestive heart failure. So actually this is the end of the lecture, and thank you for your attention.